Hello and welcome, fellow student doctors. Today, we will discuss sensory receptors, which are sneaky high yield, as they serve as the receptors for the first neurons in the spinothalamic and dorsal column medial lemniscus spinal cord pathways. Additionally, understanding sensory receptors is key to understanding pain transmission, as the structure of their associated nerve fibers explain why local anesthetics, such as lidocaine, block pain signals but still allow you to feel touch in those areas. Quite literally, understanding sensory receptors enables us to appreciate how we and our patients interact with the world every day. We are in for some fun, friends. Let's get started. To prepare you for test day, you will be able to 1. Explain how the A-alpha, also known as the type 1A, 1B fibers, mediate reflexes and proprioception via the spinal cord and dorsal column medial lemniscus pathways. 2. Explain how the A-beta, also called the type 2 fibers, mediate touch, pressure, vibration, and cold information via the dorsal column medial lemniscus pathway. And 3. Explain how the A-delta, also known as the type 3 fibers, and the C fibers, also called the type 4 fibers, mediate pain and temperature information via the spinothalamic tract. Pictured is an overview and guide to sensory receptors, which we will organize based on their associated sensory fibers. Starting with A-alpha sensory fibers, which are also called 1A and 1B sensory fibers, these are the largest sensory fibers and they are myelinated. Hence the black nerve fiber surrounded by the yellow myelin, since myelin is a fatty substance. Notably, the large size of A-alpha fibers makes them resistant to local anesthetics, such as lidocaine, which block sodium channels. Moreover, the fact that A-alpha fibers are so large and myelinated enables them to have the highest conduction velocity. Overall, they function to mediate reflexes and proprioception via muscle spindles and Golgi tendon organs via the spinal cord and dorsal column medial lemniscus pathways. Next, the A-beta fibers, or type 2 fibers, are the second largest sensory fibers that are myelinated. Due to their larger size, they are relatively resistant against local anesthetics, just slightly less resistant than the even larger A-alpha fibers. Moreover, since A-beta fibers are larger and myelinated, they have high conduction velocities to mediate their function of transmitting fine touch, pressure, vibration, cold information via Merkel's discs, Meissner's corpuscles, Pacinian corpuscles, and Ruffini corpuscles, as well as cold information with Krauss corpuscles via the dorsal column medial lemniscus pathway. Next, let's discuss A-delta or type 3 fibers and C fibers or type 4 fibers together, as they both utilize free nerve endings to transmit primarily pain, temperature, and crude touch information via the spinothalamic pathway. The key thing to understand is that A-delta and C fibers are the smallest sensory fibers, making them most susceptible to local anesthetics. Moreover, since they are the smallest fibers, they have the slowest conduction velocities of all the sensory fibers. Lastly, a key distinction is that A-delta fibers are myelinated and C fibers are unmyelinated. This distinction is crucial, as A-delta fibers transmit so-called fast, sharp pain, while C fibers transmit so-called slow or dull, achy pain. With that background, let's start by exploring the A-alpha fibers in greater detail. Let's start with the 1A type of A-alpha fibers, which mediate reflexes and proprioception, specifically via muscle spindles. You need to understand that muscle fibers are composed of two key fiber types. The first is extrafusal muscle fibers. These are the muscle fibers we traditionally think about, as they are the main contractile fibers of muscles that initiate movement. Buried beneath the extrafusal muscle fibers are the intrafusal muscle fibers that have 1A or A-alpha sensory nerve fibers wrapped around them like a spring. Essentially, this muscle spindle serves as one big nerve to detect the stretch of a muscle. To recap, the intrafusal muscle fibers and 1A sensory nerve fibers form a spring-shaped structure called a muscle spindle that lies parallel to muscle fibers to mediate reflexes, a spinal cord only process, as well as to transmit proprioceptive information to the brain via the dorsal column medial lemniscus pathway, a spinal cord and brain process. Let's use this diagram to demonstrate both functions, starting with reflexes. So, if you take a reflex hammer and you tap the patellar tendon, this will stretch the muscle spindle, which is essentially one big nerve that is shaped like a spring. So, the muscle spindle gets stretched as the patellar tendon gets stretched by the reflex hammer, which stretches the quadricep muscle where the muscle spindle is buried. Activation of the muscle spindle is transmitted along the 1A alpha fibers through the dorsal root ganglia, through the dorsal horn where the fibers of a single 1A alpha splits and contacts motor neurons and interneurons in the ventral horn of the spinal cord. Let's follow the green fiber first. As you can see, the 1A alpha fiber directly contacts the green motor neuron in the ventral horn, causing activation of the green motor neuron, which then synapses on the extrafusal muscle fibers to cause contraction of the quadriceps. This then leads to the leg kicking outward. A normal reflex. At the same time, looking back at the spinal cord, the same 1A alpha fiber synapsed on an inhibitory interneuron that caused inhibition of the red motor neuron that connects to the extrafusal muscle fibers of the hamstring. This causes relaxation of the hamstring. This makes sense because the green motor neuron activated the quadriceps muscle while the red motor neuron of the hamstring was inhibited to allow relaxation of the hamstring, letting the quadriceps kick the leg outward. By extending the quadriceps, this reduces the stretch on the muscle spindle and the leg goes back to baseline, and the reflex is complete. Notably, this reflex was mediated at the level of the spinal cord without the brain. However, you know that when a doctor tests your reflexes, you sense that your leg moved, right? This is because that same 1A alpha fiber sends projections to the dorsal column of the spinal cord to travel to the brain via the dorsal column medial lemniscus pathway, transmitting proprioceptive information to the brain about the position of the body's limbs in space. Overall, this diagram shows that type 1A alpha fibers mediate reflexes and proprioceptive information via muscle spindles. Moving on, let's discuss the type 1B alpha fibers that also mediate reflexes and proprioceptive information, but in a very distinct manner. Notice in this diagram that the type 1B fibers are connecting with tendons. This is because there are structures within tendons appropriately called Golgi tendon organs that are wrapped up in collagenous tendons with type 1B alpha fibers. Essentially, Golgi tendon organs sense the amount of force exerted on a tendon and protect us from tearing our tendons if we exert too much force via contraction of our muscles. Let me show you how this works. Say we attempted to move 5,000 pounds via contraction of our quadriceps muscle. This would exert significant force on our tendons, which would be sensed by the Golgi tendon organs buried within the patellar and quadriceps tendons, which would send signals via 1B alpha fibers to the dorsal root ganglia, where fibers would travel through the dorsal horn and into the ventral horn of the spinal cord, which contains motor neurons. Following the red neuron first, the 1B fiber synapses on an inhibitory interneuron that shuts down the red motor neuron, leading to rapid relaxation of the quadriceps muscle, which is critical as that 5,000-pound load would have torn the patellar and quadriceps tendons apart. At the same time, looking back at the spinal cord, the 1B fiber activated an excitatory interneuron that activated the green motor neuron that connects to the hamstring, enabling the hamstring to contract, which again protects the patellar and quadriceps tendons from rupturing against that excessive 5,000-pound load. As you can see, this is essentially the opposite of what we saw on the last slide. So, Some references call this the inverse reflex, as it leads to muscle relaxation to prevent tendon tearing. Additionally, that 1B A-alpha fiber coming from the Golgi tendon organ sends projections to the dorsal column of the spinal cord, which travel to the brain via the dorsal column medial lemniscus pathway, transmitting proprioceptive information to the brain about the position of the body's limbs in space. Overall, this diagram shows how type 1B A-alpha fibers mediate reflexes and proprioceptive information via Golgi tendon organs. Moving along, let's discuss the myelinated A-beta or type 2 nerve fibers, which carry sensory information on fine touch, pressure, and vibration via the Merkel discs and Meissner's corpuscles, Pacinian corpuscles, and Ruffini corpuscles, as well as cold information from Krauss corpuscles. Pictured here are the main sensory receptors whose information is transmitted via myelinated A-beta or type 2 fibers, as you can see labeled here. Note, not all of these receptors connect to a single nerve. It's just drawn that way for simplicity. Also, note that the yellow bricks represent a single Schwann cell that wraps around the A-beta fiber to provide its myelination. We will be using this image a lot, so let me orient you by detailing that this is the epidermis. Found in and near the epidermis and superficial skin layers are the Merkel's discs and Meissner's corpuscles. Below the epidermal dermal ridges, the squiggly lines here, are the dermis and deeper skin layers, like the subcutaneous tissue. Here you will find Ruffini corpuscles, Krauss corpuscles, and Pacinian corpuscles. Lastly, it is important to know that the information from these sensory receptors are carried to the CNS via the dorsal column medial lemniscus pathway. Before discussing each sensory receptor, let's discuss what is meant by calling a sensory receptor rapidly or slowly adapting. Excluding Krauss corpuscles, you can see listed on the slide that Meissner corpuscles and Pacinian corpuscles are listed as rapidly adapting sensory receptors, whereas Merkel's discs and Ruffini corpuscles are listed as slowly adapting sensory receptors. To make this concept clear, let's use an example where you will need a pencil, yes, please go get a pencil or a pen, in one of your hands. I want you to orient your hand palm up and then place the pencil on the palm of your hand. Rapidly, you felt that pencil was placed on your palm due to the rapid firing of Meissner's corpuscles and Pacinian corpuscles. However, these sensory receptors have already stopped firing because they are rapidly adapting to the presence of that pencil. So, if the pencil stops moving, the Meissner's and Pacinian corpuscles are no longer firing. You may be thinking, then, Johnny, how can I still feel the presence of that pencil in my hand? For that, you can thank your slowly adapting sensory fibers, Merkel's discs, and Ruffinian corpuscles. These receptors are slowly adapting to the stimulus by staying on and letting you continuously know that pencil is still present in your hand, as well as to discern the features and details of that pencil, like how smooth it is, where the edges are, and its overall form. Overall, this example demonstrates what is meant by rapidly and slowly adapting sensory receptors. Starting in the superficial skin, let's discuss Merkel's discs. Merkel's discs are located in the superficial layers of the skin in glabrous, that is, hairless skin, like on the palms and soles, as well as hairy skin. As with all things in anatomy, structure determines function. Notably, Merkel's discs are the only receptor on this slide that do not have a corpuscle or outer layers, hence the name Merkel's discs, because, as you can see here, many discs line the epidermal ridges to form a conglomerate that converge into a nerve fiber. To appreciate Merkel's discs, take a moment and look at your fingerprints. All those ridges are lined by Merkel's discs. Amazing, isn't it? Moreover, since Merkel's discs are discs and are not lined by a corpuscular layer, these discs are very sensitive to even minute forces as the discs are much more easily compressed than the layers of a corpuscle. And so, each disc has a small receptive field, which increases each disc's spatial resolution. Moreover, Merkel's discs are densely distributed throughout the skin. Just look at all your fingerprints. These features make them excellent receptors for discerning details of an object. This anatomy is combined with the fact that these receptors are slowly adapting to a stimulus and exhibit continuous firing as long as a stimulus is present. To put them into context, their key role is in discriminative and static touch to discern the details of an object. A perfect example of this is a key. If you were to feel a key, you could discern its form, that is, its corners, edges, and curves. The key word is form, as Merkel's discs are slowly adapting, meaning they are continuously firing to discern all those little tiny details about form on an object to you. To help you remember the function of Merkel's discs, remember this key. A Merkel's disc key, as the rounded portion resembles the shape of a disc, and to discern all the details of that key, you need the continuous firing of your Merkel's discs. The next superficial sensory receptor to discuss are Meissner's corpuscles. Meissner's corpuscles are located in the superficial layers of glabrous or hairless skin. Think palms and soles. Overall, we will come to see that Meissner's corpuscles tells you that something is there, whereas Merkel's discs, as we discussed on the previous slide, tell you what's there. To make this clear, let's examine anatomy, as structure denotes function. Meissner's corpuscles, as the name suggests, have a corpuscle that surrounds their internal sensory receptors. Interestingly, this corpuscle is filled with fluid, and when the corpuscle is deformed, this displaces the fluid of that corpuscle, which then activates those internal sensory receptors inside of the corpuscle. And so, with even small skin indentations, this shifts the fluid inside the corpuscle. This causes rapid on and rapid off firing. Think of it this way: skin indentation moves the fluid, which transfers its energy to the internal sensory receptors by colliding with them. It will then take another wave of fluid movement to activate those receptors again. And so, this is termed dynamic light touch, as it takes skin indentation, and then another skin indentation, and then another skin indentation to keep the firing of Meissner's corpuscles going, as they will almost immediately stop firing after the skin is indented. This dynamic firing is important for grip control, as when we grip an object, it indents our skin, Meissner corpuscles fire, and then they stop firing until that object moves again. Each and every time we adjust our grip, Meissner's corpuscles lets us know about the new position of that object in our hand. Before summing up Meissner's corpuscles, I want to note that they also play a role in low-frequency vibrations, as the vibrations themselves displace the fluid inside those corpuscles, causing activation. But this is not their major role, so it is low yield compared to what is high yield, and that is knowing the key role of Meissner's corpuscles, which is in dynamic or changing light touch and grip sensation. As an example, I want you to think of Meissner's mouse. Imagine trying to grip a mouse moving all about in your hand. Each new position of the mouse would indent the skin, causing fluid shifts inside the Meissner corpuscles, which then activate them, and causes you to be able to sense the new grip on that mouse as it's ever-changing. It's dynamic. Plus, look how cute little Meissner's mouse is. Aww! Moving on to the deeper layers of the skin, let's discuss Pacinian corpuscles. Yes, I will be pronouncing them Pacinian corpuscles because this is the key sensory receptor for vibration. So, Pacinian corpuscles are located in the deeper, glabrous, hairless, and hairy skin, ligaments, and even joints. As with everything in anatomy, structure determines function. As you can see, Pacinian corpuscles have an onion-shaped corpuscle that surrounds the internal receptors. So, compression of the onion's layers, or membrane layers of the corpuscle, lead to activation. The key physiological stimuli for onion compression and activation of Pacinian corpuscles is waves of vibration rippling through the layers of the corpuscle, as well as deep pressure, which also compresses the onion. By being compressible in ligaments and joints, Pacinian corpuscles aid, to some degree, in proprioception as well. Moreover, it makes sense that Pacinian corpuscles are rapidly adapting receptors that rapidly turn on and rapidly turn off, because that onion needs to be compressed and decompressed and compressed and decompressed to generate additional signals. And so, the key role of Pacinian corpuscles is vibration. A perfect example of this is a cell phone vibrating. Look at the phone. Who's calling? Well, your Pacinian corpuscles are calling you. Detecting the phone's vibration, therefore, is the key role and a key example of Pacinian corpuscles, telling you to answer that call. So, every time your phone vibrates, from every text message and every call, do this silly little trick and tell your Pacinian corpuscles thank you for their hard work in detecting those vibrations. Another sensory receptor found deeper in the skin are Ruffini corpuscles. Ruffini corpuscles have essentially the same distribution as Pacinian corpuscles. That is, they are found in the deeper glabrous, hairless, as well as hairy skin, ligaments, and even joints. As with everything in anatomy, structure determines function. Notably, Ruffini corpuscles are also called Ruffini endings, as they have nerve endings that are found within a corpuscle. Therefore, you will see them called Ruffini endings and Ruffini corpuscles. They're both, actually, as you can see in this image. Essentially, Ruffini corpuscles line themselves along stretch lines in the skin, ligaments, and joints. This alignment occurs because stretching of the corpuscle stretches the nerve endings inside the corpuscle and leads to activation. So, Ruffini corpuscles lie parallel to stretch lines in skin, ligaments, and joints. They are slowly adapting fibers that will continuously fire while being stretched. This makes Ruffinian corpuscles important for object slippage and hand conformations. Imagine holding a slimy eel. As that eel slips through your hand, Ruffini corpuscles are telling you that information as the skin is being stretched by slippage, alerting you that you may need to adjust your grip on that slippery eel. A more medically relevant example is hand conformation. As we move our fingers and hand into certain shapes and configuration, this stretches the skin and activates Ruffini corpuscles. Then, Ruffini corpuscles continuously fire, right? To continuously tell you what conformation your hand is in. That is proprioception. I always remember this with sign language. Here I am signing R for Ruffini and C for corpuscles. I know I am signing these letters because of my Ruffini corpuscles detecting the stretch of my skin. Isn't that quite amazing? And so, the key role of Ruffinian corpuscles can be remembered with the mnemonic rough stretch, as they detect skin stretching and joint position, both of which are vital for sign language. Moving along, let's discuss Krauss corpuscles. Krauss corpuscles are located in the skin, mucous membranes, and conjunctiva. As with everything in anatomy, structure determines function. Krauss endings are found within Krauss corpuscles, and as you can see in the diagram, these endings are moving around within that corpuscle. Interestingly, when these nerve endings are exposed to cold temperatures, this decreases the movement of those nerve endings and leads to activation. Fascinating. So, Krauss fibers are often called Santa Krauss claws fibers because they detect cold, and Claus is always cold in the North Pole, right? Now, I want to add to this discussion that Ruffini endings are floating around in their corpuscles as well. And you can see here on the slide that they both have nerve endings in them. That is, the Ruffini endings inside the Ruffini corpuscles and the Krauss endings within the Krauss corpuscles. Interestingly, in terms of Ruffini endings in corpuscles, Warm temperatures increase the movement of those nerve endings within the Ruffini corpuscles, leading to activation. So, another role of Ruffini corpuscles is in the detection of warm temperatures. Overall, the key role of Santa Claus or Claus corpuscles is to detect cold, while Ruffinian corpuscles detect warmth. Looking at this diagram, you may be saying, Johnny, the dorsal column medial lemniscus pathway carries touch and proprioceptive information, not temperature. Ah, friends, welcome to neurology, where the body doesn't care about generalities found in textbook. There are overlaps in these systems such that fibers can even cross from the dorsal column medial lemniscus pathway to the spinothalamic tract. Moreover, the spinothalamic tract can detect and transmit from free nerve endings some touch and pressure. Overall, for test day, know that the dorsal column medial lemniscus pathway mainly carries proprioceptive information, pressure information, vibratory information, and fine touch information from the A-alpha and A-beta fibers that we have previously discussed. Conversely, know that the spinothalamic tract is the main tract that carries pain and temperature information from free nerve endings. To complete this picture for you, let's move on and discuss how those free nerve endings transmit pain and temperature information via the spinothalamic tract. Overall, you can think of the spinothalamic tract, which carries mainly pain and temperature information, as well as some crude touch, being composed of two key fiber types. Those are the A delta or type 3 fibers and the C fibers or type 4 fibers, whose primary sensory receptors are free nerve endings. Let's discuss those free nerve endings more on the next slide. Shown here are the myelinated A delta fibers and unmyelinated C fibers. Both of these fibers transmit information about pain and temperature from their free nerve endings, which are highlighted here. These free nerve endings are coated with nociceptors that transmit information to the spinothalamic tract. Let me explain. See, free nerve endings are located throughout the skin, dermis, and viscera. In fact, they are located in all tissues except the lens of the eye and cartilage. As with everything in anatomy, structure determines function, such that free nerve endings are exactly what they sound like. Free nerve endings without any specific structures like a corpuscle. They permeate throughout the entire skin and viscera to detect noxious stimuli through nociceptors that coat these free nerve endings. Let me give you some examples. Noxious stimuli can arise from warm and cold stimuli, as well as trauma and inflammation. These noxious stimuli cause cells to become injured, either through being too hot, too cold, trauma, or inflammation that causes cells to release substance P, with P and substance P standing for pain, histamine, prostaglandins, and other mediators. See, these substances would not be released from cells unless a noxious stimulus was present. These mediators are sensed by the nociceptors on the free nerve endings. Specifically, sharp, fast pain is transmitted by A delta fibers. Why? Well, looking at the structure of A delta fibers, you can see that they are myelinated and therefore can conduct at a greater conduction velocity signals to the CNS. In contrast, slow, dull, achy pain is transmitted via C fibers. These slow, dull, achy fibers are transmitted via C fibers because they are unmyelinated. Since C fibers are unmyelinated, they must undergo what is called continuous conduction, where all along that entire nerve fiber, the nerve must be depolarized and depolarized and depolarized. Compared to the A delta fibers, who are myelinated, they undergo saltatory conduction, where only the spaces between Schwann cells, those yellow squares called the nodes of Ranvier, must be depolarized to transmit the signal. A general principle is that all myelinated fibers undergo saltatory conduction of nerve signals with depolarizations occurring at the nodes of Ranvier, or spaces between the Schwann cells, enabling faster conduction velocities. Moreover, A delta and C fibers are the smallest sensory fibers and, due to this small size, are most susceptible to local anesthetics, such as lidocaine that block sodium channels needed for nerve depolarization. A general principle is that the smaller the nerve fiber is, the more susceptible it is to local anesthetics. Overall, free nerve endings' key role is to detect cellular insults via nociceptors to transmit pain and temperature information via the spinothalamic tract. Notably, they also transmit information on crude touch, which is touch without details, which is caused by the pressing of skin, which pushes mediators towards those free nerve endings, hence crude touch. A great example of the role that these fibers play is in stubbing your toe. The immediate sharp pain is transmitted via the myelinated A delta fibers, while the later dull, achy pain of your toe is transmitted by the relatively slower, unmyelinated C fibers. Overall, here is a key summary of the main sensory fibers that are found in the skin. Recall that A delta and C fibers transmit mainly pain, temperature, and crude touch information via the spinothalamic tract, whereas the A beta fibers, shown here, and the A alpha fibers, not shown here, transmit information about fine touch, pressure, vibration, and proprioception via the dorsal column medial lemniscus pathway. Before moving on to the flash quiz, I want to discuss two-point discrimination, which is essentially how far apart physically two stimuli must be for us to perceive that there are two stimuli. In the fingertips, you know that the Merkel's discs and the Meissner corpuscles are densely populated, so the two-point discrimination is small. You could feel 2 points of a pencil relatively close together on your fingertip. Conversely, the two-point discrimination area is large on the skin of your back, for example, which has relatively less sensory receptors. So you'd have to spread those pencil tips relatively far apart to detect both pencil tips. This is all to say that the difference in two-point discrimination varies along the body based on the density of sensory receptors in the skin in that area. Time for a flash quiz. The question reads that a patient is having a cavity filled at the dentist's office. The dentist injects lidocaine into the surrounding area to reduce pain. After the procedure, the patient states that while they did not experience any pain, they could still feel the dentist's fingers and tools on the injected area. Through what fibers could the patient primarily feel the dentist's fingers and instruments? A delta or type 3 fibers, B, C fibers or type 4 fibers, C, A beta or type 2 fibers. The correct answer is C, A beta or type 2 fibers. Recall that A delta or type 3 fibers and C fibers or type 4 fibers transmit primarily pain and temperature information via the spinothalamic tract. Moreover, A delta and C fibers are the smallest sensory fibers, making them the most susceptible to local anesthetic that blocks sodium channels, like lidocaine. Conversely, A beta fibers are larger fibers and, as such, are relatively resistant to local anesthetics. A beta fibers carry sensory information to the dorsal column medial lemniscus pathway from structures like Merkel's disc and Meissner's corpuscles that enable touch sensation, which is not blocked in this patient who can still feel the dentist's fingers and tools on the injected area. I specifically put this question here because it is a classic Step 1 question, as most students read pain and immediately selected C fibers or A delta fibers and moved on. Avoid that knee-jerk reaction and critically analyze what the test makers are asking. Here it is why touch is preserved after local anesthetic use. Notably, you could use the process of elimination by knowing that pain is transmitted via A delta and C fibers, effectively eliminating those two answer choices, making A beta fibers the correct answer. Make sure you understand and ask yourself what the test makers are asking before selecting an answer choice, friends. Thank you for sticking with me throughout this lecture. Here are a few key takeaways I want to make sure you know for test day. Know that A alpha, type 1A and 1B fibers are the largest sensory fibers and are myelinated. making them resistant against local anesthetics as well as enabling them to have the fastest conduction velocities. Notably, A alpha fibers conduct sensory information via muscle spindles and Golgi tendon organs to mediate reflexes via the spinal cord and proprioceptive information via the dorsal column medial lemniscus pathway, which involves the spinal cord and brain. Know that A beta or type 2 fibers are myelinated and of relatively larger size, making them resistant to local anesthetics as well as enabling them to have fast conduction velocities. Specifically, remember the key sensory receptors associated with these fibers, using the symbols of Merkel's key for form perception, Meissner's mouse for dynamic touch and grip, Pacinian corpuscles for vibration, with a symbol of a vibrating phone, Santa Claus or claws for Krauss corpuscles, which enable cold detection, and sign language of the letters R and C for Ruffinian corpuscles that mediate stretch detection, warm temperatures, and joint position. Notably, all of this information is transmitted via the dorsal column medial lemniscus pathway. Next, know that the A delta or type 3 fibers and C fibers or type 4 fibers primarily mediate temperature, pain, and crude touch via the spinothalamic tract via the sensing of mediators like substance P for pain from cells that activate nociceptors on the free nerve endings of these fibers throughout the skin and viscera. It is extremely high yield to know that A delta and C fibers are the most sensitive to local anesthetics due to their small size, which relates to the fact that they have slow conduction velocities. Additionally, C fibers are the most sensitive to local anesthetics and are the slowest conducting sensory fibers due to them having the smallest nerve fibers, as well as the fact that they are unmyelinated and must undergo continuous conduction of action potentials. Friends, if you enjoyed the lecture, give it a big old thumbs up and leave a comment, even if it's just to say hello. And always, always, always remember, there is a great big beautiful tomorrow.